So, the Dermatology Academy has this philosophy called Practice Safe Sun, which is this whole regimen where you try to avoid sun during the most harmful time of day between 10 a.m. and 2 p.m. We say if your shadow is shorter than you should probably, find some shade. Sitting under shade, wide brim hats, sun protective clothing like long sleeve shirts, long pants, and sunscreen. It's all part of this whole philosophy of trying to protect yourself from the sun.
Thank you for joining us for another episode of Spotlight Houston, where we bring you the best of the people, places, and events in Houston. This week, we sit down to talk about how to keep your skin safe in the summer fun with doctors from Bellaire Dermatology Clinic, Kayla McNiece and Lauren Floyd. Spotlight Houston is a production of Story Zone Media. This is episode 89 with an original air date of Monday, June 3rd, 2024. And now your host, Blanca Quezada.
Hi, everyone, and welcome back to Spotlight Houston. I know that summer is here, but, I got to talk about it. So some of us, not me, because I'm not a sun worshiper, but some of us like to go out and sit by the pool or go to the beach and get as much sun as we can and just be outdoors all the time. And that's a great idea because I've always heard getting some sun is good for you because of vitamin D. But a lot of us, I think we don't really understand that sometimes being out in the sun can be a little dangerous. We like the walks and everything, but I think that it's a great idea if we learn a little bit more about what can happen if you do get like a sunburn or other problems because you've been hanging out in the sun too much. So kind of like skin cancer. So in order to protect our skins, to find out a little bit more how to protect our skins, I've invited two amazing doctors. They're incredible. And they're going to inform us all about everything we need to know on how to take the right precautions for ourselves and for our children from the sun rays. So they are Dr. Kayla McNiece.
Correct.
And Dr. Lauren Floyd. They are with the Bellaire Dermatology Clinic. Welcome to the show.
Thank you for having us. Thank you so much for having us.
So Dr. McNiece is a skin care specialist. She specializes in skin cancers, facial reconstruction, tropical dermatology, and complex medical dermatology. And Dr. Floyd specializes in medical dermatology, skin cancer, and dermatologic procedures. So it's great to finally have you here on the show. I'm so excited. As I mentioned, summer's here and lots of us are just hanging out in the sun. So what is the first thing that you recommend before we go out walking or go to the beach or the pool? I know that sunscreens are normally recommended, but it's kind of confusing on which one to select. Can you tell our listeners who or which brand we can get or what it is we need to pick up?
So, the Dermatology Academy has this philosophy called Practice Safe Sun, which is this whole regimen where you try to avoid sun during the most harmful time of day between 10 a.m. and 2 p.m. We say if your shadow is shorter than you should probably, find some shade. Sitting under shade, wide brim hats, sun protective clothing like long sleeve shirts, long pants, and sunscreen. It's all part of this whole philosophy of trying to protect yourself from the sun, especially in Houston in the summertime. It's pretty direct sunlight around here. Even on cloudy days, especially, you can still get some sun. So there's a whole kind of breadth of things we do for it.
So how long would you recommend that we be out in the sun?
Well, as long as you're covered up and you're not getting dehydrated and things like that, there's not a limit there's no safe amount and there's no limit. It's more of a making sure you're covered and reapplying your sunscreen. So if you're wearing a nice wide brim hat, if you're wearing a nice long sleeve shirt, these new sun shirts that have come out, and you're reapplying your sunscreen every 2 hours, one of those broad spectrum, water resistant sunscreens, then we consider that a protecting yourself from the sun and keeping away most of the harm's raised, but you do want to avoid being out there in the middle of the day.
What I like to coach my patients, since I work on skin cancers, I have the luxury of going through proper sun protection with my patients. So the American Academy, like Dr. Floyd mentions, they have 3 guidelines. You want to have SPF 30 or higher. You want it to say UVA/UVB or broad spectrum, and it needs to be water resistant. Those are your first 3 goals of sun protection. And then once you've achieved that in your sunscreen, your next goal is to reapply your sunscreen every 2 hours or immediately after sweating or swimming if you're going to be actively outside. So like Dr. Floyd said, I find that is honestly kind of difficult. So that's why I like the wide brim hats and the sun protective clothing. Another tip and trick of the trade for me is I like powder sunscreen. So that's something a lot of my patients don't know because it's relatively new. This makes it easy to apply because you can apply it without getting your hands greasy. You can put it in your car or your gym bag and it won't melt. It goes on over existing sunscreen and makeup, and it's dry and not irritating. So for like my golfers and my men who don't want to sweat, cream off and burn their eyes, I find that a lot of my ladies like it because it can go over makeup. A lot of my men like it because it doesn't have a scent, it doesn't have a smell, it's not greasy, and it doesn't burn their eyes. Kind of similar approach with the stick sunscreens that you can now find over the counter. It look like deodorant sticks. The same things apply to those. So as long as you've got the 3 things with your sunscreen, that's a good start for buying a product over the counter.
And does it make a difference on the texture of your skin or the color of your skin?
So everyone should be wearing sunscreen regardless of skin tone. Some people find certain products are better for their skin type, whether it's the sprays, the sticks, the creams, but the really important thing is to get enough sunscreen on your skin. Most people are not putting on enough sunscreen. The data shows that the average person is only putting on half the sunscreen they need. To cover your whole body would be a shot glass worth or 1 ounce of liquid sunscreen for your whole body. And no one's doing that every 2 hours for the most part.
Mm-hmm. And you know what I've noticed is that a lot of people will have like a suntan on their arms or their hands. And I think that comes from when you're driving too long and the sun is just hitting the window. Right. And because it's happened to me sometimes as well. So we should be doing that sunscreen every day, whether we're going out to the pool or going out to the beach or just hanging out in the sun, right?
That's right. So I love that you asked this question because all of my men hate sunscreen. And what I tell everyone that my goal for all my patients is that they wear sunscreen on their faces every single day. And then for the men, I say, don't forget the tops of your ears and the backs of your neck. Simply because, like you said, driving around Houston, sitting in traffic, walking the dog, checking the mail, talking to the neighbor, watering the plants, these things add up over the course of a day. And so it's important that everyone wear their sunscreen every single day and then go extra measures if you're going to be out for extended periods of time.
Yeah. So there's something I'm a little confused about. What is the difference between a chemical and a physical sunscreen?
So it comes down to the active ingredients. So physical sunscreens are ones that they may say mineral on the front. They contain either zinc dioxide or titanium dioxide or both on the active ingredient list, while chemical sunscreens would have a different set of things in the active ingredient list. It wouldn't list those two. Then they have combination sunscreens that have zinc and titanium with other things. So when you look at the active ingredient lists, you can check. But the most common is it will say mineral if it's a physical sunscreen. The difference is how they work. The really important thing is to get one of them on. That's, like I said, water resistant. Dr. McNiece mentioned water resistant. Put it on 15 minutes before you're going to go out when your skin is dry. It works better that way. And then making sure it's at least SPF 30 and up.
To just kind of add on to that, in general, the physical sunscreens tend to be a little bit better for sensitive skin, where the chemical sunscreens can be sometimes a little bit more irritating. Also, chemical sunscreens, though, blend in better. They're easier to sometimes rub in so it doesn't look as white and pasty. Although I must say that producers are getting really good at making their mineral sunscreens thin and easy to apply. The other thing that I like about physical sunscreens is they do take effect a little bit faster than chemical sunscreen. Like Dr. Floyd mentioned, if you have a chemical sunscreen, then you're going to want to apply it and let it sit for 15, 20, 30 minutes before you go out into the sun, whereas your physical sunscreens give you a little bit more benefit a little faster.
Are these sunscreens also safe for kids?
Yes. So the American Pediatric Society recommends at 6 months starting to put on sunscreen. That doesn't mean you should be out in the sun without it when they're under 6 months old, but they do recommend putting sunscreen on kiddos and avoiding direct sunlight if you can. You don't want your kid to get a sunburn. They don't really tend to complain. They can start to turn pink, and you don't want them to get sun when they're that young and start getting sunburns. But
Mhm.
if their parent has any concern, they do like the more physical sunscreens for kids. They have a bunch of different brands that are kid safe, and they have the zinc or titanium. What I think about is the active ingredient in baby's butt paste is zinc, and then your sunscreen is zinc. So we know that it's a safe ingredient for kids to use.
Can we use these in sun tanning beds?
Well, we're never going to like you saying you want to use a sunscreen bed. So the American Academy of Dermatology and overall FDA has decided that sunlight is a known carcinogen, and that includes tanning beds. So even if you're going to do spray tan, spraying your body to get a fake tan is not considered protective either. You still need to wear your sunscreen, and there is no safe amount of tanning bed use for skin cancer prevention.
Yeah, I think the spray tans are kind of dangerous in my perspective because you're breathing in that chemical.
Just to kind of add on to what Dr. Floyd said, I recently read that the World Health Organization added tanning bed use to its highest cancer risk level. That is equivalent to smoking. And so I thought that was really interesting that something that is seemingly so innocuous is actually now considered in the highest cancer risk category.
Wow, I hadn't heard that before. I mean, I had heard that it was bad, but not that bad. So when we have or see something strange in our skins, how do we address that skin concern?
So things we think about with a concerning spot, the easy kind of simple way, is it bleeding? Is it changing? Is it growing, itching, painful? Any of these things should make you be thinking, hey, should I get this checked? And the people who are going to be checking it the most thoroughly with the right equipment is going to be a dermatologist. So either talking to your primary care about getting an appointment or calling a dermatologist to have it checked, just because we can determine in clinic, either by looking at it or doing a biopsy, if it's something that's dangerous or not.
And how often should we see a dermatologist?
So that depends. We do say that if you're someone with a history of skin cancer, you're going to be going in a lot more frequently, more than once a year to see a dermatologist sometimes. And for people who they're in their 40s or 50s and they've never seen a dermatologist, we have them come in, we're taking a look, we'll do a baseline skin exam, and they'll often need a yearly skin check just to keep an eye on their moles or given their sun exposure history, especially living in Houston. So it's a good idea to get a baseline skin screening and see how things look, and especially if you've had a lot of sun exposure.
Well, people get all different kinds of skin conditions. And is it possible that they might be signs of another body issue that they might have? Maybe something wrong with their kidneys, their heart, their liver, or something?
Yeah, so there are several kind of skin manifestations for internal disease. They are a little bit like esoteric. For instance, if you have liver failure, you can have yellowing of the skin, increased blood vessels that comes with other physical exam findings. Different things like heart disease that usually presents with swelling in the legs and then the golden brown change on the lower legs. Yes, there are lots and lots of little bitty manifestations that can occur, like thyroid disease, drying of the skin, scaly skin, loss of the sides of the eyebrows. It gets really nitty gritty. But in general, yeah, a lot of things do present with signs on the skin.
And that's
So,
one of
yeah.
the really amazing things about dermatology. It makes such a fun specialty, is that you can sometimes just see things that interact with other organ systems, and diseases present with the skin or correspond. And so it's something we look at when you come in.
Yeah, you can alert your patients to other conditions that they had no idea they might have.
Exactly.
Yeah, yeah. So, what happens if you ignore a skin condition? Does it matter what condition you have?
It does. So, for instance, if you ignore skin cancer, there are some long-term consequences like local destruction, and sometimes they can spread inside the body. And I can get into that in more detail. But other things like eczema or psoriasis, these things can have social implications. They can be uncomfortable. They can be itchy. If they're scratched a lot, they can turn into infection. There are other really weird wonderful bullous diseases where people have blistering skin, and that can lead to kind of chronic pain, increased risk of infection inside. So it really does depend on the skin condition that we're talking about. I hope that gave you kind of an overall idea. Dr. Floyd, do you
Yeah.
have any thoughts on that?
I had an old mentor who used to say, dermatology, we do save lives, melanoma, invasive squamous cells, things like that, which Dr. McNiece will get into. But we also improve quality of life as a specialty, whether it's like she was saying, psoriasis, and you're having a rash, itchy, burning, spreading, eczema, things like that. And so some things will impact your life expectancy, and some things will just impact how you feel in terms of how miserable your skin may feel. So I think it's important to, if you have an issue that's ongoing, you don't have to live with misery or have a spot that's growing and spreading. So
Yeah.
it's important to get checked.
Yeah. Recently, I heard that we have microscopic and I was like, is that true?
You were probably reading about the little Demodex mites that love to live on like our eyelashes. Yes. And you can't really see them with the naked eye, but
Right.
yes, you could see them under the microscope. So you'll probably never notice them, but it does seem a little bit creepy. I know.
Yes, it does. It does. We have a lot of creepy little things on our skins and our bodies, right? So, what are the most common skin cancers that you normally see?
Yeah. So there are three major types of skin cancer. So the first is basal cell carcinoma, which is the most common cancer period in mankind, and it makes up about 80% of the total cases of skin cancer that we see. And basal cell carcinoma is a type of sun-grown skin cancer that typically happens after years of sunshine or childhood sunburns. And these typically look like little shiny bumps, new shiny bumps on the skin, or sometimes they look like little scaly pink patches. And the important thing with basal cell is that they tend to grow. They oftentimes like to bleed, and patients will often tell me that it continues to bleed and it just never heals and it just never goes away. So the good news about basal cell carcinoma is that it almost never spreads inside the body. But if left untreated, it will sit there, it will grow locally, and it can become locally destructive. So again, good news, but it can become locally destructive. And then the second type, cue squamous cell carcinoma slide. The second type of skin cancer is called squamous cell carcinoma. It too is a sun-induced skin cancer that happens after years of sunshine or sunburns. These tend to form pink scaly patches or little pink bumps on the skin. Now, unlike basal cell, these can spread inside. Most of the time, they just sit on the skin and they behave themselves. But if left there long enough, they can spread to lymph nodes and other parts of the body. So, and then the third most infamous type of skin cancer is called melanoma. And melanoma is made of the melanocytes, so the pigment cells that pigment our hair, our skin, and our nails. And with melanoma, patients can do very well or they can struggle. So if you catch a melanoma early on, it can be easily removed and highly treatable. If you allow it to sit on the skin and grow deeper, it can spread to other parts of the body, can spread to distant organs, and patients can struggle. And these tend to look like brown, black spots or bumps. They tend to have multiple colors in them, being brown, black, white, red, blue. They tend to have an asymmetric texture or border to them, and they tend to evolve or change and grow. So those are kind of the tips and tricks of looking out for melanoma.
So, what are the risk factors of having skin cancer?
So the number one risk factor is UV radiation or sun exposure. So people who have fair skin, light eyes, light hair, they're at an increased risk simply because they don't have the pigment in their skin to help block that UV radiation. So along those lines, tanning beds we just mentioned, that's radiation hitting the skin as well. Also people who are immunosuppressed, whether it is acquired like HIV, or we have a growing number of immunosuppressed patients who are transplant patients who are on anti-rejection medicines, and then also patients who are undergoing cancer treatment with chemotherapy or immunotherapies. In addition to that, family history can play a part, smoking can play a part. If you have a history of dysplastic nevi or abnormal moles, those can also play a part.
Can they become life-threatening?
Yes. So basal cell is almost never life-threatening. Squamous cell can be, although it's usually not, treated relatively quickly. And then melanoma can be the deadliest of them all. In fact, It's estimated by the American Cancer Society that over 8,000 Americans will die of melanoma in 2024. So it can be quite deadly, but keep in mind, if we catch it early, if we catch it at its most superficial place in the skin, then it's highly treatable and those patients do great. In fact, their 5-year life expectancy is over 99%, according to the National Cancer Institute.
Yeah. Does melanoma ever show up in our fingernails or our toenails?
Yes, great question. So melanoma typically occurs in sun-exposed areas, but 1/3 of melanomas can pop up in non-sun exposed areas, including the bottom of our feet and in our nail beds. So nail melanoma typically looks like a band, like a dark brown band in your nail plate. It's actually technically in your nail bed, but it looks like it's on your fingernail itself. These tend to be kind of wide, like over 3 millimeters. They tend to be asymmetric. This band may crawl onto the surrounding skin. But keep in mind, there are also benign forms of pigment in the nail so if you see pigment in your nail, doesn't mean you have a melanoma, but it very rarely can pop up in the nail.
Can going to I can never pronounce this, an esthetician,
Esthetician, I think.
Esthetician. There you go. I can never pronounce it. I'm sorry. Can they also help?
So estheticians and dermatologists both serve an important role, but they have different roles in treating the skin. So a dermatologist is going to be a medical doctor who's graduated from medical school, completed a dedicated dermatology residency. It's a 12-year process at minimum to complete from start to finish. And so a board certified dermatologist is someone who's an expert in basically anything hair, skin, and nail related. Physicians were licensed to make a medical diagnosis, prescribe medications, or perform a surgery. Estheticians also work on skin health and appearance. They have to go to an esthetician or cosmetology school, and they have to be licensed in the state where they practice, and they perform things like facials, acne treatments, and sometimes laser treatments. So it's a different roles they each serve.
Yeah, because I think a lot of times, a lot of people, for some reason, I don't know, they go to an esthetician to get some kind of treatment. And also when people walk in, they see like a menu of treatments and then they just decide, oh, this will work for me, right? When honestly, it may not.
It's true. I will say that a lot of people in the field over time do get experience and can see things that are abnormal. So it's not uncommon for estheticians to come and grab one of us and be like, hey, there's a spot that I'm not so sure about. Can you look at it? So I will give our hairdressers and estheticians props and family members, because if something looks abnormal or if it's changing or it's not, one of these spots is not like the other, that can be helpful information for a patient to decide to seek treatment by a dermatologist.
Yeah. And what are some of these treatments?
Oh, yeah, for skin cancer. So if it's really superficial and non-aggressive, sometimes we can use a cream. Sometimes we use just a little cautery. Times we can do an excision, which means we take like a safety margin. We cut out a safety margin around the little skin cancer and stitch it up. And then sometimes your dermatologist will recommend that you have Mohs surgery by a board-certified Mohs surgeon.
What does Mohs stand for?
Yeah. So Mohs surgery is named after Dr. Frederick Mohs, the man who created the technique. And this is a specialized skin-sparing procedure that we use for skin cancers that are either large or on the head and neck, cosmetically sensitive areas, those that are recurrent or aggressive under the microscope. And with this technique, we perform it in the clinic. So a patient is saved the risk and the expense of going to the OR and under general anesthesia. What we do is we bring the patient in, we do a little local numbing so that the skin is asleep, the patient's comfortable and doesn't feel anything. And then I simply cut out what I can see of the little skin cancer with a very narrow, tiny margin. And then I have the patient wait. I take that little specimen to the lab processes the tissue, and then I get to look, I as a surgeon, look under the microscope at all the margins. So I look at the entire periphery and the entire depth to make sure the skin cancer is gone. If it's gone, great, we move to the healing process. But if it's not gone, I make a very detailed map, kind of like a clock face, and I mark where the tumor remains, and I return to the patient, and at that margin where the tumor remains, I take a little tiny bit of skin more, and we do that whole weight study process again. And this allows us to have about a 99+% cure rate for many skin cancers. And the beauty of it, we study all the margins. We know it's gone when you walk out of the door, and it allows us to keep the little wound as small as possible, which ultimately results in easier closures and better healing and better cosmesis.
Is radiation also a treatment?
Can be, yes. So superficial radiation, I know, is gaining a lot of popularity. And I think that it has its certain place in certain instances. So it's usually used for non-aggressive skin cancers, and it's usually used in patients who are not great surgical candidates. Mohs surgery is still the gold standard of care and has that 99+% cure rate, where superficial radiation has variable cure rate, not quite that high, but I definitely think that it's like I said, growing in popularity, although the preliminary studies are, where I guess I could say they are retrospective, meaning they look back in time, and the stats aren't quite as high as surgery. So it's definitely an option, but it's not, right now, it's not the best option for patients.
Yeah. Can they come back? I mean, can these melanomas regrow?
Absolutely. So like I said, with Mohs surgery, the recurrence rate is less than 1%. With an excision, cutting a safety margin, the risk is about 2%. If we use cautery, it's about 5 to 10%. If we use a cream, it's about 20 to 30%. And again, I'm kind of painting with broad strokes, but the more aggressive the treatment, the higher the cure rate and the less likely it is to come back.
We were talking about sunscreens for our skin protection, but is it possible that some people are allergic to sunscreens?
People tend to be more allergic to the chemical sunscreens. Dr. McNiece, I think, mentioned earlier that for sensitive skin, so for those who are more allergy prone, eczema, things like that, they tend to tolerate physical sunscreens, mineral sunscreens better than chemical sunscreens just because they just don't react as much to things like zinc or titanium on the skin.
How do you know if you're allergic to them? Is it because you get a rash or just a lot of itching or something?
Different people present differently, but a lot of times you'll put it on after people used to have burning, itching, a red rash will appear just in the areas you've applied the sunscreen. It doesn't lead to things like swelling of the lips or tongue or things like that. It's more of a contact rash from the sunscreen. But if you have any of that, then I would consider switching to a different sunscreen or checking to see if the sunscreen's still good because they're rated by the FDA to last at least to be 3 years. You can have a sunscreen. But that time goes down if it's been in your hot car, if it's been at the beach with you, if water's gotten in it.
Right.
And we think in dermatology, unless you bought a bulk supply, you should be using it often enough that you are running out of the sunscreen to need more within that year. So you're not having 5-year-old sunscreen sitting around your house.
I wish we had more time, but we're running out of time now. So if people would like to get in touch with you or find out more about these skin conditions, if we're not wearing the moisturizers with the SPF 30s or the sunscreens or anything like that, where can they get in touch with you? Or do you have a website where people can get a little bit more information?
Absolutely. So there are 2 websites that I would recommend to everyone. One is the American Academy of Dermatology, so aad.org, I believe. Is that right, Dr. Floyd?
Yes.
And then for skin cancer, there's the American College of Mohs Surgery, ACMS. If you go to either website, they do a great job of providing educational literature on different skin conditions, different treatment options, but more importantly, they can help you find a board-certified dermatologist or board-certified Mohs surgeon in your area. You just click under Find a Physician, you place your zip code or your location, and they will pop up a list of board-certified physicians who can help. So again, wealth of knowledge and also kind of helps you locate a provider in your area.
Can they get in touch with you at the Bellaire Dermatology Clinic?
Of course. So yeah, you can always call the office and mention that you heard us on the radio and that we can see you for general questions and certainly surgical consult. We also do a lot of cosmetics, which is really fun. That's a whole different topic, a whole different fun beast, but you bet. We are there and busy over at Bellaire.
If they look up Bellaire Dermatology Associates on Google, we're basically the first one. We're in Bellaire, Texas, not Bellaire, California, obviously. So
yeah. You're right here in Houston. It's great. Yeah, you do have to come back and talk about more skin issues and how you get to take care of all these issues for adults and children. Because sometimes we forget that little kiddos also have a lot of issues sometimes. So, but thank you so much for informing us and letting us know that it's really important for us to take care of our skins.
Thank you.
Especially during the summer, right?
Absolutely.
During the winter, I think it's more of the dry skin, right?
yes, eczema is flaring all winter long. So
Yeah. So is there a phone number also that we can call?
yes, we'll post it too, but it's 713-661-4383.
Great. Thank you. Thank you so much again. And it was great talking to you. And also, as always, I'd like to thank everyone for joining me for this week's edition of Spotlight Houston. Hope you can join me again. And also, if you have any story ideas or any comments, please get in touch.
Thank you.